not show you the exact extent of the carious lesion. Okay. So what do you think? This is a moderate case, maybe this is an advanced case. Or if it is advanced, you are thinking this is an advanced carious lesion, it may be a severe carious lesion. So, or in the periapical diseases, sometimes in the early lesions, there is no radiographical finding, or there is no bony changes evident in the radiograph. But the patient history, your clinical findings will help you to diagnose this one. So in case of very early lesions, okay. Sometimes there is an history of anomalies. Sometimes there is a patient history of familial history of anomalies. Sometimes there is a formation of the tooth, the number, size, shape, and structure. So depending upon the your clinical diagnosis, you will go for radiographs. Usually for dental anomalies, we go for panoramic radiograph. Okay. Sometimes there is impacted tooth, sometimes delacerated tooth, surgical treatment may start early, but then you will go for panoramic radiograph. And lastly, there are some hidden diseases. Patient may not come to you for this one, which is not their chief complaint. Then you need to go for this is called the hidden lesions. Then you need to choose some particular radiograph. So maybe there is no symptom from the patient. So there is no clinical history of the patient or any chief complaint. Sometimes there is small carious lesion, sometimes very small cyst which is not swollen up, or small tumors which is at the beginning of the tumor that patient is not feeling anything. And there is no swelling, but in the radiograph, you're suspecting in the clinical examination, there is something there. Then you need to go for radiograph. So, or sometimes there is some clinical signs, but it is very difficult to determine. So you need to go for radiograph to on the particular site to see what it is, and then you need to explain this one to your patients. So in the positive historical findings, such as history of periodontal therapy, when you will go for radiograph, history of endodontic therapy, history of healing after the surgery, you need to see in the follow-up cases that whether this surgical site is properly healed or not. You will go for radiographs. Okay. The history of the anomalies, if there is any previous history or familial history of these anomalies, you will go for radiograph. And history of any type of pain, trauma, you will go for radiographs. Okay, and if there is any implant, present or future implant site assessment, you will go for radiograph. If there is any deep carious lesion, so you need to determine whether you will go for restorative treatment or endo treatment, depending upon your clinical examination and radiograph. Suppose in this radiograph, which is pulp is not involved, but if you go for restoration, maybe sometimes pulp can be open, so that you need to change your treatment plan to endo. So depending upon your need, you will go for radiographs. And the periodontal disease, large or deep restoration, miscellaneous impacted canines or impacted teeth, you will go for particular site, what type of radiograph you are available, you will go for that one. Okay. Sometimes there are facial swelling, evident of facial trauma. Then you may go for at the beginning you will go for panoramic radiograph. Panoramic radiograph will give you a preliminary idea. Then, depending upon the size, shape, or extent of the disease, you will go for 3D radiograph, whether MDCT or CBCT, if you want to see the bony involvement of this lesion or facial structure. Sometimes if it is soft tissue involvement, you may go for MDCT, soft tissue window, or MRI, depending upon your need. Or any trauma, you will same. You will go for MDCT or MRI for after preliminary diagnosis with the panoramic radiograph. Okay. Sometimes there is a mobility of the teeth. There is sinus from the periapical lesion, and suspected systemic disease, the clinical history of the patient, clinical examination. It depends upon your clinical examination and your questioning. Sometimes patient may hide the information, so you need to take it out from the patient or patient attendant. Positive neurological findings in the head and neck, so depending on the history of the patient, and sometimes there is growth abnormalities, cleft lip and palate. You may go for occlusal view or panoramic radiograph, then for 3D view, CT or CBCT. Spacing, eruption, or migration of the teeth maybe depend upon the panoramic radiograph or periapical radiograph. If there is any foreign object, sometimes in the androtreated tooth there is broken files, or sometimes the perforation. There is some trauma cases. There is a foreign object embedded in the soft tissue, as I mentioned earlier, and sometimes there are, while there is extraction, some broken bone have been there, a broken root have been there in the extraction site. You need to see this one, so you will choose your radiograph. Either it is periapical or panoramic, depending upon size, shape, and of the foreign objects. Pain or dysfunction of the TM joint. For only these cases, mostly these cases, we go for, if we suspect there is a disc dislocation, you will go for MRI. Otherwise, CBCT or CT will give you the, if there is an osteophyte formation or erosion of the condylar head, that depend upon your clinical examination. So whether you will go for CBCT or TM joint, for hard tissue, you will go for CBCT. For soft tissue, disc, you will go for MRI. Sometimes there is a facial asymmetry, then you will go for panoramic radiograph or MDCT or CBCT. And fixed or removable prosthesis, if it is a smaller one, you will go for periapical radiograph or panoramic radiograph, depending upon your clinical examination. There is sometimes unexpected bleeding, unexplained bleeding site. So you need to see whether what is hidden behind this, what is the cause behind this bleeding. So you'll go for radiograph, sensitivity of the tooth, unexplained. Sometimes there is resorption, or there is abrasion or erosion. So you will go for radiographs. Okay. And unusual tooth morphology, calcification, color, or dislocation. Maybe there is a history of trauma of this patient. Previous history, maybe 5 to 10 years ago. So there is a discoloration.